Have you ever heard the expression, he flipped his lid? In the dictionary, it's defined as suddenly losing control or becoming very angry. However, it doesn't always have to be about anger. For example, you might say, she was so excited she flipped out. While the phrase dates back to the 1930s and 40s, Dr. Dan Siegel has popularized a model that helps illustrate how our brains work. By understanding how our brains and how the brains of our young people we work with function, we can plan activities more intentionally. This allows us to support self awareness, practice self regulation through co regulation, and help young people when they become dysregulated. Explore some of the other quick guide videos to dive deeper into those topics. But let's get started with the hand model of the brain. Now, I'm not a neuroscientist, and I'm not sure that any of you watching this has studied the brain, but this model has been really helpful for me in demystifying how the brain works, and I hope it'll be helpful for you as well. This is called the hand model of the brain. It was coined by Dr. Dan Siegel. He's a clinical professor of psychiatry at UCLA School of Medicine, among a long list of other accomplishments. If you want to explore this further, there is so much research and actually a lot of very digestible YouTube videos about it. But here's our quick overview. We're going to pretend that your hand is your brain. The reptilian brain is thought to be the oldest part of the brain and controls your heart rate, breathing, body temperature, things you don't need to think about to make happen. It's also where your fight, flight, and freeze reactions come from. This is your automatic response to threats, both real and perceived. Like fight would be, this is like your aggressive response to a threat, where flight is you running away from a threat. And freeze is that inability to react at all. There's also another term that has been added. It's called fawn. That is meant to reflect the survival tendency to respond with actions to please, appease, or avoid conflict. The next part of the brain is the limbic or mammalian brain, which includes the amygdala, hippocampus, thalamus, and the hypothalamus. Again, not a neuroscientist here, but the words do ring a bell from the science classes in high school. But you don't have to remember the words, but it is important to understand what this part of the brain is responsible for. This part of the brain is connected to your emotions, memories, relationships, and habits. That is an important part to keep in mind. The hippocampus, that's where those memories are connected to emotions, and amygdala, that detects danger. Then there's the cerebral and prefrontal cortex. Again, very simplified, but this is the part of the brain that's most evolved. You can see here, this is where your higher order thinking happens. Awareness, problem solving, focused attention, self-control, and judgment. Earlier, I mentioned the amygdala. This is the almond shape. Here it's shown as the thumb, but that's the almond shaped part of the brain that serves as an alarm system when a threat, again, whether it's perceived or real, occurs. It signals to those other parts of the mammalian brain that then relay the alarm to the reptilian brain, disconnecting the cerebral portion. So that's why those fingers then are up. They're disconnected from the rest of the brain. Here's another way to look at it. When the amygdala, that alarm system that is represented by the thumb, is safely tucked in that center limbic mammalian brain, it's like the cortex and prefrontal cortex, those fingers, it's like they're hugging the emotion and the memories. It feels safe, it feels connected. When you're in this state, you can access those higher functioning components like focused attention, self control, mindfulness, awareness, judgment, problem solving, planning. That's when we're kind of at our best. However, when the amygdala, that alarm system, gets activated, it flips the lid. Here's an example to consider. Let's say you're out for a walk and someone walking a dog comes towards you. If you have good memories associated with dogs, maybe you have had a dog or you like to go to the dog park. If you're like me, you might ask if you can pet the dog, bend down, and scratch them behind the ear. If this is how you would respond, you are in a regulated state represented by the closed fist on the left. Your prefrontal cortex would be fully operating. If you've had a negative experience with dog in your memories, Maybe you haven't been around them much, so you're not familiar, or you actually had one nip at you when you were little, or maybe even worse. That same situation might result in an increased cortisol, stress hormone, that sends your heart racing, breathing accelerated, that alarm goes off. That process is activated in that limbic part of your brain, which then results in the prefrontal cortex disconnecting from the rest of your brain. That's where the phrase flip your lid fits in. It represents a person becoming activated. When that happens, you disconnect all those great thinking and processing skills and expose the limbic area, where your emotions are and that reptilian brain signaling a threat, where the fight, flight, freeze, and fawn are located. That shifts a person's ability for reasoning, attention, awareness, all those great higher order thinking components to not be accessible anymore, and big feelings take over. This can be where some of those dysregulated behaviors start popping up. With the dog walker example, a person that is activated by a dog approaching may exhibit behaviors that seem unreasonable to someone who isn't activated by the same scenario. So, what can cause that activation? It really can be different for each person. It could be influenced by their current state. Maybe they're under stress or overstimulated, have anxiety about something or fear that would result in this reaction. It also can be a result of adverse childhood experiences, traumatic experiences, historical trauma, or systemic oppression. There are a lot of factors that impact what would activate someone and cause that helpful part of the brain to go offline. Stress, distress, and trauma all interfere with learning. And an interaction that might not be a big deal to one person could be triggering for another. The hope is that we can support someone to get to that cortex reconnected, hugging those other portions of the brain. When in this state, a person is regulated. Things are predictable, the cortex is ready to engage in all of those activities you have planned, and they can access and build all those skills that we talked about earlier. If dysregulated, the cortex gets shut down, or shown here with the open hand that flipped their lid. Input doesn't get received by the cortex. Dysregulated behaviors are not chosen, they're not planned out or targeted against staff. I like to think of the phrase, they aren't giving me a hard time, they're having a hard time. What this also suggests is that the response you can expect from a participant in a program can be influenced by their current state and the skills in self awareness and regulation that they have. When a young person is able to show up as their best self, you know that they understand the expectations of the program, the schedule, how people interact with each other. You can have rational discussions where they can demonstrate their awareness of what is going on around them and make solid decisions. But when someone's activated and the cortex is disconnected, this is why it's impossible to rationalize with someone who is in that activated state. And I think we can all think of examples of what that response might look like in programming. If in a fight mode, you might see outbursts or demanding behaviors, controlling or being manipulative or undermining. If they're in the flight mode, it might look like anxiety or panic, wanting to leave, fidgeting, avoidant behaviors, or even disconnecting. Freeze mode, it can show up as shutting down, isolation, seeming numb, zoned out. Maybe they are responding, but it's with phrases like, I don't know, or I'm not sure. And fawn, you might see that as constantly seeking approval, overly helpful, and being submissive. Suddenly you think, I know you know the rules. Why are you acting like this? Well, behavior is language. They're having a hard time and they need to protect those inner parts of the brain. So, this is just a basic introduction on what can be happening in the brain when someone is dysregulated. But the good news is that we can help young people and adults over time build self awareness and practice strategies for regulation that allow them to recognize before they flip their lid and be able to minimize the reaction, allowing them to bounce back more quickly after being activated or even avoid flipping their lid altogether. So, what's next? If you haven't already, download the handout about this session's topic as a reminder and include some reflection questions as well. Then continue to build your own regulation skills. Adults who are dysregulated cannot support a young person to get regulated. Build your own awareness of how your body feels when you're experiencing difficult emotions. Identify what strategies work for you to understand and effectively manage and respond to emotional experiences you have. Find strategies that help your body when you're under stress, and identify a colleague or friend that you can go to as your self regulation support. And explain the hand model of the brain to someone else. I know for me, hearing something is one thing, but the more I talk about it and try to teach it to someone else, the deeper I understand it and find myself thinking about or using it in conversation with others and using it to help myself frame things. Use the handout that goes along with the video. That can be helpful for this particular point. And now that you are hopefully have a better understanding of the brain in a regulated or dysregulated state, be sure to check out co-regulation and the self-awareness and regulation practice videos to continue to explore how you can support young people to better understand themselves and the skills to recognize when they are becoming dysregulated, or as Dr. Segal would say, about to flip their lid.